My name is Shannon Molish, and I'm the founder of Brain Frequency. So Brain Frequency was developed to tackle a complex problem. It's when psychiatry, science, and therapy came together to try to help balance the mind. I've been treating mental health for many years, also substance use disorder, and as a result, I kept seeing people that continued to relapse. It didn't matter how smart they were, what their IQ was, people would just continue to relapse, and I wanted to find a solution. And I saw that the solution was centered in the brain. So Brain Frequency does three things. First, we'll do a brain map. And back in the day, they used to do a brain map and say, here you go. And you couldn't understand it and they couldn't do anything with it. So it was like, great, here's my brain, now what? We're able to do a brain map, and we're able to see in different areas where the brain is affected and out of balance and where it is in balance. So what we're able to do is actually treat the brain. So we stimulate the neurons that might be out of balance and go ahead and create balance. And then that helps many different types of symptomologies. So when we do someone's EEG, it is, we can see where the deficits and the strengths reside. And so everybody's brain functions differently. And what we're able to do is capture how that brain functions at its optimal level. And then we infuse that where it might not be operating at its optimal level. We go ahead and infuse that brain with that level, and the report is, I feel so much better. The symptomology starts to go away, and it's just a very cool thing to watch. This is a painless, drug-free, non-invasive approach. This is not TMS, which is transcranial magnetic stimulation. With transcranial magnetic stimulation, they are focusing on one area of the mind, the dorsolateral prefrontal cortex. That is not what we're doing. We are looking at the different areas of that person's brain that require balance, and we are then getting those neurons to fire so that it retains the balance. Oh, this is much more gentle than TMS. TMS sounds, and I've heard, feels like a jackhammer. So our brain runs off of electricity, and our own electricity. And what we do is we use magnetics to go ahead and stimulate the different areas of the brain that require balance. And your brain kind of says, oh, I noticed that. I recognize that. I used to be there. Let me go ahead and get in line. And then, like I said, the symptomology starts to dwindle away. Most people cannot feel the brain frequency treatment that we do. It is very gentle. It is, in my opinion, the first approach you should take. I have treated so many people that have tried numerous medications for antidepressant or sleep. And rather than put something in your body that's foreign, what we're doing is magnetizing the area that your body will respond to, and then it creates balance for that. So the balance, their brain can go out of balance for many reasons. First, organically. My son was born with ADHD, okay? The brain can be exposed to traumatic forces, such as a concussion, an accident. It can also be exposed to emotional trauma. So for example, you've been through an event where you've lost someone in your life, and then maybe an accident. And so what happens when these events occur is that your frontal cortex shuts down. And for some people, it doesn't quite turn back on again. And so what we're able to do is turn that area back on, and they'll report things like, wow, I can think clearer. I don't have to read things several times. I pick it up right away. So trauma can happen lots of different ways, even environmentally. What I've noticed is that, we're all on our phones, we're on computers, that's got artificial blue light in it. And so, or somebody's had shift work, or they're not outside getting sunlight in the morning. And so what I see a lot of is sleep disorders. And so what we're able to do at Brain Frequency is balance those areas of the brain, so we balance the circadian rhythm and people get really good sleep. And then all those other issues, such as I was feeling a little foggy headed and things like that, start to go away. On average, people require about 40 treatments. We ask that they commit to this treatment. We're starting to neuromodulate the brain. We want to go ahead and keep the progress that we've made. And so it's really important once you start this treatment, you're committed to finishing it. Some people can finish in as soon as 20 treatments. Some people may need 30, but what we found with mental health and substance use disorder, it's an average of about 40 treatments. They can go twice a day as long as it's 3 hours apart. So you can start your treatment and complete it in a couple of weeks or 3 weeks or 4 weeks, and that's determined by the provider that's treating you. So with TMS, they have one treatment plan. That's it. It's 120 times the motor threshold and in one area of your brain. We are looking at your individualized brain, how it operates, and tailoring it as we go through treatment. So once you complete treatment, normally people don't ever have to come back and see us. Life can happen. Somebody can get in an accident. People may start to age in their 70s and 80s and start to deteriorate a little bit. That's when people may want to come back and see us so we can see how things are going. Some people will come and see us for a cognitive reboot. We update our computers, we update our phones, we install malware, but people don't take care of their brains. And over time, working really hard, not getting good sleep, we can deteriorate our own brains. And what we've been able to do is get an EEG and help people have what I call a little cognitive reboot so that they can enjoy all the years they worked so hard for, they can enjoy their golden years. If you're a provider and you want to incorporate this in your practice and you have a wellness clinic or you're a psychiatrist or even a therapist, give us a call. We'll help you out and get you started. If you're a potential client, if you're interested in getting this treatment yourself, please give us a call and we will line you up with one of our providers.